I'm a therapist that's seen hundreds of patients, and these are the top 10 lessons that I've learned when it comes to working with patients with depression and what has been most helpful for them. So I hope these tips and tricks are helpful for you too. So, the first lesson is that thoughts are not facts. When we struggle with depression, our thoughts also become a little bit more negatively warped. In therapy, we call these cognitive distortions. For example, catastrophizing. People with depression will often kind of think of the worst case scenario when it comes to different situations, or they might mind read and think that other people think that they're boring or worthless or that they're a loser. And as a result, their mood gets more and more depressed because they treat these thoughts as very important and then as if they were fact. But one of the things about cognitive therapy, what we do here is to be able to challenge these thoughts in terms of their validity. Are they truly grounded in reality, or are they maybe a little bit more negatively warped and don't actually accurately represent how other people feel or what is likely to happen in reality? So, one way to do so is to be able to challenge them through cognitive therapy or through mindfulness by allowing these thoughts to be let go, recognizing that thoughts are just thoughts, they're not facts, and we can gonna say, okay, like I don't have to attend to this one any longer, and I can just let it go. So a second lesson is that sometimes thoughts are true, but they're not particularly helpful. Like maybe you didn't actually do very well on a recent test, and you're rightfully thinking you're not a particularly great student, at least at this time. The thought itself may have some validity, but it may not have a lot of utility because it's actually just going to make you feel worse and feel ashamed and feel guilty and feel more and more depressed, which then makes you kind of back off from doing schoolwork, lay on the bed, and procrastinate even more, which only leads to a vicious cycle of doing even worse in classes. So sometimes thoughts may necessarily be true, but they're not particularly useful. And as a result, we can kind of let them go as well, just because they don't really serve our purpose. And we have a lot of other potentially more alternative, helpful thoughts that can actually guide us towards our goals. A third important lesson in depression is that behaviors can precede how we feel. And the reason why this is important is that when we feel depressed and hopeless and we feel sad, we don't want to do anything. We want to stay at home, lie in our bed, procrastinate, not interact with anybody. But as a result of that, we start losing all the things that gave us that sense of joy and meaning and connectedness, which makes us only feel more and more depressed and keeps us in the depression trap. So one thing that's really helpful to know is that in the cognitive behavioral therapy model is that our behaviors, our thoughts, and our emotions all interconnect with each other such that influencing one can influencing the other. So something like changing our behaviors can influence how we feel. So even if we don't feel like doing something, we can still do something in terms of our behaviors to then influence how we feel. So to act first and then feel second. And lesson number 4 is to give yourself some self-compassion. When we're feeling depressed, it's easy to be super hard on ourselves and call ourselves stupid or weak or worthless. And all those things only seek to make us feel crappier and crappier and really, again, feed into this depression cycle. And one thing that can be, of course, the antithesis or the enemy of self-criticism is to provide yourself with some self-compassion. And now this is easier said than done. When we feel low, we're not really wanting to give ourselves a little bit of that grace. Even when we feel good, we're usually our own worst enemies and we tend to be pretty self-critical. So one strategy I find really helpful is something called the best friend technique, where we ask the question, if a best friend or a parent or someone I really cared about and loved was in the same situation as me, what would I say to them? And you'll often find that whatever you do say is extremely compassionate, extremely kind, extremely empathetic. And then maybe what you can do after that is to take those same statements and see if you can give yourself a little bit of that self-compassion. So lesson number 5 is to make the first step as small as possible. When we're feeling depressed, we're feeling pretty malnourished in terms of our overall energy levels, and everything, even like getting out of bed, can feel like a mountain of a chore. So as a result, we don't want to set ourselves up for failure by having these high expectations and then failing to meet it, but rather generate momentum by making that first step as small as possible. So maybe your goal is to be more active, and you can plan for a 3-minute walk instead of a 30-minute run. Or if you want to do some more homework, to say, okay, I'm successful if I could just open to the first page and write a couple sentences rather than feeling like I need to do 10 hours worth of work to make up for everything I haven't done yet, which again only creates and feels a sense of guilt and shame and self-doubt. So make that first step as small as possible and then go from there. Lesson number 6 is that our predictions are not necessarily always true. When we're feeling depressed, it's easy to kind of think things like, yeah, even if I were to try to do that thing, they wouldn't want to say yes anyway, or that even if I apply for that job, I'm not going to get it. And it makes perfect sense that when we feel depressed and have a low sense of self efficacy and self worth, that we don't think good things can happen to us. But as a result, it almost becomes a self fulfilling prophecy because we then decide not to do the thing because we just expect or anticipate what we predicted to be true. This is called fortune telling in terms of cognitive distortions. So, one thing that can be helpful is to take the approach of a curious scientist. Well, yeah, that's how I feel. I don't think it's going to work out, but why don't I give it a shot anyway? I mean, I'm not a mind reader. I don't really know exactly what's going to happen. So, maybe I'll get some more, alternative data. Either, things are exactly what I expected, so nothing changes, or maybe something good happens and maybe I can get a little bit of competing evidence against my usual negative predictions. So, similar to number 6, number 7 is about developing a more healthy alternative core belief. So core beliefs are kind of like fundamental ways that we think about ourselves, other people, and the world, where in the context of depression, our core beliefs are usually pretty negative, like I'm worthless, I'm unlovable, I'm ineffective, and there's nothing I can do to improve my depression. So one thing that can be helpful is to identify what could be a competing, more helpful core belief of like, maybe there are people who like me, or maybe I can be effective insofar that there's something I can do to improve my depression. And the goal is to gather as much evidence as possible that fuels and feeds this alternative competing core belief. Like for example, if your competing core belief is that you are an effective person, that maybe you can find evidence from your past or from the things that you're doing right now that does allow you to grow and to feel better. Maybe you ended up taking that walk despite feeling really depressed, or you ended up watching this video to really get to learn a little bit more about how to deal with depression. All of those things can be competing evidence towards the initial core belief that you're not doing anything and nothing you do will be helpful. Lesson number 8 is to change the implicit question. Oftentimes, people with depression don't really want to do anything good for themselves because they answer the implicit question of, do I deserve it? And their answer is, no, I don't. But what we can do is to actually change the question from do I deserve it to is it helpful? Would this be effective towards my goals? Would this be helpful towards what I want to do and my values? And by changing that question to one of like a values judgment to one of more effectiveness and utility, we can kind of break away from the shame and the guilt to actually just do the things that matter most to us. Lesson number 9 is that even though all of this is just a drop in the bucket, with enough drops of water, we can fill the entire ocean. And the reason this is important is because when we feel depressed, all of the actions that we take, everything we try to do to resolve our depression, it all kind of feels like a drop in the bucket. It all just feels so small. But with enough of these actions, with enough of these steps, you can absolutely get to where you want to be. So don't stop. One drop will lead to 10 to 100, and at some point, your entire bucket will be overflowing. And lesson number 10 is that medication can also be helpful. So especially in the context of more severe depression, what the research suggests is that combination therapy, a combination of medication and psychological treatment like cognitive behavioral therapy work really well together to support the best possible outcomes. Because when we're feeling truly severely depressed, it's hard to even go to therapy and engage at all. So having the medication can be helpful as an initial oomph to be able to then take advantage of the therapeutic components. And as a bonus lesson, lesson number 11, is to not shame yourself for having the disorder. Oftentimes we can think of ourselves as weak and helpless and feel, disempowered for the idea of having depression. And you can kind of hear this in the self-help space where people kind of say, depression is not a real thing. I don't accept it. I reject the idea of having depression because it takes away autonomy and power from myself. But for other people, the sort of fight against the idea of having something like depression, where it could be kind of similar to having a common cold, for example, this actually disempowers them because it makes them feel like guilty and ashamed for being weak to kind of deal with these kind of low mood and kind of other symptoms. So one thing that can be helpful is to say, you know what, like this is something I'm struggling with. Give yourself a little self-compassion, because self-compassion doesn't mean you stop doing anything. It means you're giving yourself enough grace to then offer yourself the space to be able to do the things that you need to do to get yourself feeling better. And that's it, the top 10 lessons that I found particularly helpful in my work with patients with depression. I hope you found it useful too. If you did, I encourage you to subscribe because I'll be talking more about depression as well as other mental health related issues down the road. Take care.